U.S. Department of State. This is the December session of the Global Coalition to Address Synthetic Drug Threats, Sub-Working Group 1.1, Manufacturing of Synthetic Drugs and Their Precursors, West Region. We had the East Region meetings last week. Today we are having our West Region meetings. I have a few administrative announcements to get us started, and then I'll turn it over to our, sorry, let me fix my camera there. Turn it over to our co-hosts. First, I wanted to update everybody on civil society engagement. As you may recall, when the coalition was launched in July 2023, there was a ministerial declaration on accelerating and strengthening the global response to synthetic drug threats. And at that meeting, participating governments through this document expressed their commitment to taking into account input from civil society in coalition objectives. The coalition, as you all know, started their monthly meetings, and the determination, consensus by governments was that the coalition live meetings, these Zoom meetings that you're participating in today, would only involve the presence of governments and not civil society. So this alternative plan, this alternative system has been developed, and that is a series of mechanisms to engage civil society over the coming months. You will find more information on our website in the coming weeks as we post that, and there's the website address. But in short, there are 5 major initiatives. First, we will invite countries to have national dialogues with their civil society representatives, organizations, between the months of January to February. And the United States will lead by example. On the 27th of January, our White House Office of National Drug Control Policy will convene a meeting of civil society organizations and invite them to share their experiences, their ideas with regard to the topics of the 3 sub-working groups. Second, a global civil society forum will be organized by the Vienna NGO Committee over in Vienna at UNODC, and that will take place at the end of January. Third, we will invite civil society to exchange experiences on the coalition website, that is, articles or videos or other information they would like to post. Fourth, we will be inviting recommendations from civil society organizations that will be posted directly on the coalition website, so concrete, actionable recommendations for programs or for policies. And fifth, we invite the sharing of achievements that civil society organizations have accomplished to also be shared on the coalition website from April to July. Also, at the discretion of co-chairs, civil society representatives may be invited to participate at specific sub-working group meetings, again, at the discretion of co-chairs, and it will be announced with a separate link if we move in that direction. Finally, I'd like to share with you all the website for the Global Coalition. It's globalcoalition.us. And I want to highlight one part of that, which is the section for each of the sub-working groups. So on those sites, you can find the background of the sub-working group meeting topic. You will find all the past recordings as well. You will find the upcoming agendas for the coming month, and you will also you are also invited to submit videos for the website should you have also more content to share than we have time for during these meetings. So those are all my announcements for today. Please check out the website. And with that, I am going to turn it over to our co-chairs for today, Henning Root and Andrew Cunningham. Over to you all. Thank you.
So, thank you very much, Brian, and welcome to everybody. Thank you very much for taking the time out of your busy schedules and days, especially this time of the year, to join us on the December issue of the Global Coalition. It's an honor for me as well to be a co-host here, and I just want to throw you over to Andrew, then we can kick off today's over to you, Andrew.
Thank you very much, Henning, and thank you to Brian for these opening remarks. I think it's really important that we involve civil society in the discussions that we're having about synthetic drug threats. We should try our best to support those sessions when they come up. Yeah, as Henning said, this is the December session of the Global Coalition. And as you know, this sub-working group is focused on the manufacturing of synthetic drugs and their precursors. So this morning, or this afternoon, or this evening, wherever you are, we're going to have 3 presentations. 2 of these will be live presentations, and the third one will be recorded. So after these presentations, we'll have time for a bit of discussion on this topic. And we're really going to be focusing on the practicalities of dismantling laboratories today, the training that's available, and some of the policies and strategies that are in place for dismantling labs and the disposal of the chemicals and equipment that is recovered from those illicit processing places. So for our first presentation, we have Ms. Luisa Fernandez, who is working at the UNODC. And Luisa is going to provide us with a presentation about national disposal plans, including safe handling and disposal of synthetic drugs and chemicals used in their manufacture. So I think I saw that Luisa is on the line. Are you there, Luisa?
Yes, I'm right here. Thank you for the introduction.
Perfect. You have the floor.
Thank you, Andrew. Let me share my screen for just a second.
Luisa, and if you can try to speak a little bit closer to the microphone, that would be perfect. Thank you.
Sure. Just if you could also confirm when you see my screen, please.
I'm going to confirm as soon as I see it.
Perfect.
And we see that you are sharing your slides, but I don't see the actual slides yet. Maybe that's an issue on my end.
Okay. Just give it a second and let me know.
And now we can see the slides. Go ahead, please.
Perfect. Thank you so much. So, dear colleagues, chairs, thank you so much for your time. And I'm very happy to be here and joining you in the subgroup one-on-one. I'm going to be addressing national disposal plans, which for that we have to address first the safe handling and disposal, of course, of synthetic drugs and the chemicals that are being used. So in order to do that, I will begin with just sharing with you a little bit of what we see in the World Drug Report. And this is how basically the World Drug problem and the challenges are we facing by region. And why am I starting with this? Because in order for us to do disposal and to support the governments and build capacity, we need to know what exactly we need to do disposal of. Because the problems are completely different when we're addressing, for example, natural-based drugs as cocaine, and a very different one when we're developing disposal plans for ATSs or opioids or opiates. So in order for us to begin and to understand where we are and the challenges that countries are going to face, we need to understand what we're seeing. And you can see very clearly here that the problems are regional, but overall, when you see the whole world, you can see different trends and different routes, of course, of the precursors that are needed for the production of each one of these drugs over the world. For example, and I want to go from the broad to the specifics. Here you can see, for example, this the seizures that have been reported officially to the questionnaire, and we can see here in the World Drug Report of fentanyl. And you can see here also the precursors, the finished product, and the precursor chemicals and how they're moving. And this is very important to us because once we start having these successes of large seizures, then the problem starts to begin. And if the question is that the governments, after you have the headshot on the newspapers, what do you do with that? And it seems that many countries haven't asked that question. And it seems that the process ends after the seizure. And then it becomes a problem throughout the years, months, where you don't have the proper infrastructure, where you don't have the capacity to actually finish the process. And the process finished when you have the disposal. So you keep seeing this. And the question is for us, what are the trends? What are we seeing worldwide? And what we see is that traditional and emerging countries are changing what we usually see. So for example, we have new sub-processes of trafficking points of precursor chemicals. So for example, in Central America, you see more and more these countries that don't have a very good and effective control measures being used for diversion or for smuggling or trafficking by land, by air or by sea. But also we see the transcontinental, regional, and sub-regional illicit flows of precursor chemicals, which disposes different challenges and more requires an expertise for our frontline officers and the customs personnel to actually know how to identify all these precursors that are not controlled, and that pose different challenges for people that are right there and don't have the proper equipment, not only to do this safely, but actually the technology to actually identify them. So what do we see? Once we seize, this is what we see. We don't have proper infrastructure to have temporary warehouses. So what our frontline officers are doing is basically doing whatever they can with what they're seizing. And we are seizing large quantities. And you can see all the statistics in the World Drug Report. So after you've been putting this for a long time, months, some countries even years, you start facing problems in the environment, in the health of the communities around this temporary warehouse that are temporary because it tends to be a lot of years altogether. And of course, the health risk for everyone that is safeguarding all of this. So this poses a serious threat for everyone, because this also, how do you control this? And how are you ensuring that this is not reintroduced to the illicit market? So after we keep seeing this, we, as the specialized program of UNODC, it's called STAND, Solutions, Training, and Advice for Narcotic Disposal. It's a recent program. We've been on the floor only for 2 years. We started doing national assessments. So what we wanted to know, and we developed a tool for this with 50-something variables, is what are actually the capacities of the country to deal with this. And with this, we are not only assessing capacities of law enforcement and the judicial process to actually do disposal, but overall, what's the whole capacity of the country? Because we're also looking for public-private partnerships, local and public partnerships. What is actually capacity of customs? Who is in control on the disposal of this? So we did national assessments for all the countries that we are working on. And this, of course, provided us the practical steps to actually do disposal plans. What we've done is to build capacities. We did specialist technical trainings. We did missions to identify inventories. We did regional trainings, because for us, it's very important that countries start sharing their information, because we see sub-regional trends of diversion of production that we didn't saw before. So in Central America, it's very important that countries start sharing information, especially neighboring countries, and the same in South America. We're seeing new routes, for example, from Brazil going to Africa, and Ecuador becoming one of the most important ports of exporting illicit goods through for Europe and to North America. So for us, it was important that we bring this to a regional level. This is, you can see how many trainees and beneficiaries we have had. But more importantly is that we have resources that we have already developed that is for everyone that is listening and not listening, for safe handling and disposal. We have manual, we have guidelines, we have trainings. We are about to launch a module within the UN toolkit of synthetic drugs on safe handling, on which you can have videos and best practices that it's all free. And for us, and more importantly, our results are based on basically emptying warehouses, whether it's drugs or chemicals. We have had 10 disposal exercises throughout the region, over 400 tons of precursors in Ecuador, Guatemala, and Honduras. And Guatemala and Honduras are mainly precursors used for synthetic drug production, and 450 tons in Ecuador, which was become, from 1 year to the other, one of the countries with the largest seizures of cocaine. And this method could be easily applied to many other countries. We have invited European countries to see this, because it's very efficient, it's very environmental friendly, and you can dispose large quantities of drugs as you go. And the third important component for us was the identification of best practices that were sustainable, that other countries could apply with limited resources, and that they, of course, are environment friendly. And this was very important, not only because this could allow a South-South cooperation, but also because once other countries see that this could be fixed, the disposal could be fixed, they're starting kind of getting inspired to fix a problem that you have had for 8 years, 10 years, right? So this was very important. And to other member states that are listening to me, there are solutions. All the countries can find a solution for this. What we see is once you start doing disposal effectively, you start having more seizures. I cannot explain this. I cannot give you an official statistic of this, but we have seen this everywhere we go. Once we start having disposal and emptying the warehouses keep filing up again, which is basically what we're aiming. And here I am sharing with you 3 best practices we have identified in Colombia, which they resell these chemicals to certified users. Ecuador, as I told you, the encapsulation of cocaine, and the public local partnership for non-hazard chemicals to be disposed. Guatemala, which you can see the picture here of the National Disposal Center, who was also supported at some point by INL, but also has a method with a private-public partnership for repurposing, which is very important because disposal has a cost to all the countries, but there are ways that this could be more effective. And of course, and I'm running low on time, so I'm gonna rush into this. There are other identified needs that we're seeing, especially in data. If you don't have international standards in this, it's very hard to have an inventory in place and therefore to have an effective disposal plan. But we have to work in an interagency matter. Control, customs, law enforcement, police, judges, everyone has to work together, forensic services. Otherwise, we're not going to identify the trends. We're not going to find what country is seizing what and how, if they are becoming a production country. And what we are promoting is that we have a comprehensive approach on manufacturing and trafficking, composed of these elements, from national assessment to enhanced data management, reducing access to precursors, addressing clan production, safe handling and disposal, of course, and one of the most important components for us is regional collaboration. And just to wrap it up, I want to bring all of you your attention for all the C&D resolutions and frameworks that have been developed throughout the time, especially the last one that was made in the C&D this year, which brings the attention to all member states and of course to UNODC to work and develop the necessary measurements to take action to the safe handling and disposal of synthetic drugs, their precursors, and other chemicals used in the illicit manufacture of drugs. And with that, I'm wrapping it up. I'm Luisa Fernandez, Regional Coordinator for STAND, the specialist program of UNODC on safe handling and disposal of drugs and their precursors. Here in the QR, you can find other resources, and we are ready and stand ready to support you and member states on capacity building and addressing this problem. Thank you so much.
Thank you so much, Luisa. That was very good. Thank you for sticking to the time as well. I think we've got time for a few questions, if we can have some, please, in the chat, or if someone's keeping an eye on that, Asma or Connor. I completely agree with you. You can't manage what you don't measure. Yeah, we need to be monitoring what's going on very, very carefully. I'm working at the EU Monitoring Centre for Drugs and Drug Addiction, and this is our daily business, monitoring what's going on in the member states, because it's only by seeing what's going on you can actually gather some evidence to do something about it. So it sounds like you're already working on quite an integrated program in STAND at UNODC, and lots of things are already developed. Do we have any questions?
We do. There's a question in the chat from Stephanie Overe from Belgium, who's asking, are the national assessments published? And then we have one hand raised.
Thanks for the question, Stephanie. Nice to see you in the meeting. Is this a question you can take, Luisa, about national assessments? Yeah,
of course. So national assessments are basically owned by the government. So they're not open for the public, but we could ask the country if they are willing to share with the other countries. They're usually, that's a yes. We have right now 5 assessments and developing 2 more. for the region. So we're open to even discuss a little bit further. If you don't want to see each one of the assessments, we can have a bilateral to discuss all the components that we analyze. How was the process and what are some of the key results? Because each assessment, and let me tell you, this is like completely different from country to country. Because if we start with a legislative and all the national framework analysis. So only with that, you get different results from each one. But I'm here to discuss and the colleague, I think it was from Belgium. If you want to have bilateral, I'm happy to share with you some of the results.
Okay, I see there's a hand raised by Antonio Lomba. I think we have time for one more question before we move on to the next speaker. Antonio?
Yes, good morning. Antonio Lomba from CCAT OAS. Luisa, thank you for that great presentation. I wonder to what extent the legal landscape or the regulation is an obstacle or a challenge whenever you're talking about disposal. Is there any kind of a legislation the countries that you see that you work with use as a framework, or could you talk about that a little bit? Thank you.
Thank you, Antonio. Sorry, Andrew, should I take it?
Go ahead, please, Luisa.
Thank you, Antonio. Nice to see you. Thank you for your question. As I said before, we start the first component we do when we're doing assessments is the legal analysis. So different countries, different scenarios. Some countries have it easier because they have it all centralized in one institution. So basically the same institution that does the seizure, that does the disposal, that does the control. Some other countries, you have 6, 7 institutions involved just to have a final disposal. So I cannot tell you if it's like a challenge, but it's very particular of each country. What we see, and we see this constantly, is that the lack of, let's say, actualization of the laws, that poses a serious challenge. But also when someone makes, let's say, a normative framework that contradicts other normative framework, and I'm going to be very specific on this example. For example, when law enforcement develops this new approach on disposal that it's not in line with environmental law, for example, that causes a backlog. And that's when we get in and we identify this on the national assessments, and then we do some recommendations, and it could include, for example, legislative framework. The last example we have is, for example, Peru. Peru couldn't do the encapsulation of drugs because the only method that they have is incineration. And when the law says this incineration, there's no other way you can do this. And this was posing a lot of challenges in their infrastructure, in their logistics of bringing all the cocaine seized in the country. So recently we had this amendment on the law, and now they can also do encapsulation, you know. And this is part of the support we've been doing with INL on the field. So that's great. Just to
listen,
give you some
Luisa,
examples.
I think it's great, and I don't want to stifle the Q&A, but I think we need to move on to the next speaker now. And I see that Antonio from INCB has put a point in the chat about not just dismantling laboratories, but investigating them as well. I think we'll see in the next couple of presentations that this is exactly the approach that we should be taking. So I'll pass over to Henning now to introduce the next speaker. Over to you, Henning.
Thank you very much,
Luisa,
Andrew.
once more.
Thank you, Luisa. Thank you very much, Andrew. I just want to add something that Luisa said as well, that here in South Africa, as a best practice, if it comes to the disposal of chemicals or waste produced at clandestine drug laboratories, she touched on private-public partnership, and that's exactly what we are doing here. We also don't stockpile seized precursors or stuff like that. So each and every seizure, we make use of a private company, environmental company, that will basically come to the scene, and the chemicals will get seized, and it will get destroyed in the prescribed manner, either encapsulation or incineration. So over here, for us as a big best practice, that works because, like we said, we don't sit with a warehouse full of chemicals that we don't know what to do. But that said, I want to pass over to our next speaker, which is Brian Escamilla. He's going to give us he's going to talk about clandestine drug laboratories. Brian is a forensic chemist at the NES. So over to you, Brian. Thank you very much. So,
well, thank you guys for having me. I will pull up my screen here and see if I can't. All right, can you guys see that screen?
Yes, please go ahead.
Okay. All right, well, thank you. On behalf of the Colombo plan, we went into some of these countries, and there's some training objectives we wanted to put into place as we went into these countries. We designated certain narcotic teams in these regions, and what we did was we brought them in and we focused on the trends that were going on in their country. So certain countries have certain synthetic processes that are trending in their areas using certain precursor chemicals and reagents. So what we did is we put together all the materials that would train these guys on how the synthetic drugs are being processed, the equipment to look for, the precursor chemicals to look for, both in diversion of stuff coming from chemical supply companies or commercial products, the dangers of the gases and vapors that would be given off during the processes. So when they do entry, they have an idea what they're up against. And we also train them on the air monitoring. So they have an idea when they go into these sites, whether it's a go, no-go situation based on the air monitoring equipment readings. And by putting them into the suits, we physically gave them the opportunities to challenge the problems of having heat stress. When you put these chemical suits on and wearing the respirators, heat stress becomes a big issue. So we've trained them in how to monitor themselves, how to monitor their team. Wearing the respirators, they have limited vision as they have to breathe through the respirators. Obviously, each breath has to go through a cartridge. So we put them in the equipment and have them go into the laboratories, practicing, taking the air monitoring measurements and making decisions. And then as they're in there, we talk about the process of evidence collection, sampling, wearing their equipment, pulling the samples with pipettes and pH paper, gives them the challenge of practicing with the dexterity challenges of wearing all this equipment as they go in. And then lastly, we trained them on how to identify unknown liquids, unknown powders, using the equipment that they have available. So as we go in, we provide them with the equipment, we train them on it, the limitations, the uses, and then again, specifically to the trends that are going on in their area. So in this last year, we hit 6 countries: Kazakhstan, Nigeria, Honduras, Colombia, Guatemala, and South Africa. So each of the countries we had to profile using intel we got from the State Department that what was trending in their areas. And ironically for Kazakhstan, their synthesis labs went up from 2 to 40 in the course of a year, but they were primarily seeing alpha PVP and mephedrone being synthesized. So we went and went through the process with them, how alpha PVP and mephedrone are being made, the precursor chemicals, what it looks like. Being that this is a crime scene, but a crime scene where the evidence can kill you, we emphasize the importance of safety for these guys as they dismantle the site and then collect their evidence. So we...
And my apologies, Brian, I'm very sorry for interrupting. Interpreters are asking you to slow down, please. Thank you.
Okay. So as we went into the countries, we went through the process of dismantling the laboratories, and then as they exit, the decontamination of the personnel and the equipment that leave the site. So it's basically managing a hazardous materials site, in essence, a crime scene with hazardous materials, and the process of preserving safety and the evidence, and then decontamination of all the personnel and equipment as they came out. So in the countries we went to, again, Nigeria, they had problems with methamphetamine and Captagon. So if you're familiar with Captagon, it's amphetamine and theophylline. Ironically, the real Captagon's not there anymore. It's being replaced with multiple synthetics or clandestinely produced methamphetamine. So we went through the different processes for manufacturing methamphetamine. They primarily see the red phosphorus routes, and that does have some toxic gases and releases that come off that particular synthesis. So with their air monitoring equipment, we went through the process of identifying not only the gases, but how much was there, and to ensure that their equipment was safely going to protect them as they dismantle the site. in certain scenarios where we could, we performed live methamphetamine cooks, not only so they can see how the drug is being manufactured, but this also helps them in their courtroom testimony as an expert witness that they've manufactured methamphetamine from start to finish, from precursor to product. So we're capable, and where we had logistics, we were putting up live methamphetamine cooks for these people to actually witness, see the process unfold in front of them. For Honduras and most of our Central America countries, we have a lot of problems with cocaine cultivation, heroin, the extraction laboratories that go into that. So we cover the chemicals that are being used to extract the cocaine from the coca leaf, the opium, the gum, the morphine from the gum itself. And then we also got intel that they've recently started receiving vials of fentanyl. And the fentanyl is being diverted from medicinal sources. They're in ampules, pre-measured out, and they're breaking up the ampules and adding it to certain narcotics as they're being put together, processed. So in Honduras, we did cover, again, the basics of doing entry into a hazardous material site, the air monitoring, the decontamination, identification of unknowns. We also put them into respirators, and for each of the students we give a respirator to, we actually fit test them to make sure that that respirator works and is going to function for them in the field. Colombia, again, another Central America country with cocaine cultivation, extraction laboratories. They also have a problem with a drug called 2C. Now, if you're familiar with 2C, actually it goes back to an original drug called 2CB, which was street termed Nexus. 2C is also called liquid cocaine. We see it both in powder and in liquid form. It's usually discolored to a very bright pink. Now, 2CB as a drug has since been replaced by some of the other synthetics that have been coming out of China. So we see a lot of mixtures now of some of the synthetic compounds, the substituted cathinones, and other unique synthetics that are being mixed in with the 2C to give it that hallucinogenic effect that the Nexus, the drug 2CB, actually had. So there's problems, and recently we've seen where they have been also receiving diverted medicinal fentanyl ampules. They were taking the ampules, breaking them open, and adding them to the 2C itself. So in most of these countries, there's a major fentanyl training component that's being added to the training, and the safety, the safe use, the handling, the use of Narcan, what antidotes we have, and the other options besides naloxone for the antidote. But a lot of fentanyl training has been embedded into the trainings now, with the fentanyl popping up in some of the other countries. So with Colombia, we did an advanced school that primarily focused on the 2C and some of the other synthetics that are being not only synthesized in the area, but moved through the area, and how to handle these compounds. In Guatemala, same scenario with the cocaine, the heroin. They also have cannabis, but we focused also on the methamphetamine, some of the chemicals that are going into Mexico, primarily to support the P2P synthesis route of methamphetamine in Mexico. The chemicals are coming into the Central America companies and coming up through land-based avenues. So we did cover a lot of the chemicals that are being moved through country into Mexico, through Guatemala, and again, the identification and safe handling of these chemicals themselves. In addition to that, we did cover the chemicals that go into the extraction and the processing operations for manufacturing the cocaine from the coca paste, and then the heroin from the morphine that they got from the opium poppies. So in that country, we also did a basic clandestine laboratory class, which trained them in evidence collection. We gave them the respirators with fit testing, and gave these guys the opportunity. In this case, we had them actually sample a fentanyl spill, and gave them the opportunities to wear all this equipment, do air monitoring, and then go in and safely collect the evidence in that case. So South Africa, we did see where methamphetamine is being produced. Ironically, their precursors, some of it's coming from the ephedra plant itself, along with diverted pseudoephedrine from pharmaceutical grade materials. They've also got a problem with methcathinone. And methcathinone is basically a drug, another drug we can make from pseudoephedrine. So we went through the processes that go into manufacturing methamphetamine by the routes that we see out there in South Africa. The process of manufacturing methcathinone. They've also got a problem with quaaludes. Mandrex is a problem out there. We've also went through the whole process of the limitations of the PPE, the hazards that go into each of the processes with the certain chemicals, the gases and vapors that would be produced not only from the chemicals, but from the reaction processes themselves. And then again, identifying specifically what they were seeing as far as the chemicals that are coming into and going through that country. So in each of these courses, what we've tried to do is specifically go in and address the threats that are facing the narcotic investigators in those areas. We also cover certain chemicals are not safe to handle for sampling purposes. In certain situations, the crime labs have no protocols for analyzing certain components of the evidence. So we also embed in there using the crime labs as a source for where this evidence is going to go. What chemicals could the crime labs use to safely analyze and for prosecution of the criminals and suspects in this case? We go through the evidence collection, but not sampling everything and warning them of certain chemicals that they should not be handling. We talk about their personal protective equipment to ensure that they know that there are limitations to the gloves and the suits. Certain chemicals can penetrate, and we address which ones those are. We also address the air monitoring, and the equipment that we have with the training can be used to safely assess the site, specifically if it's a go, no-go situation where they have to pull the team because the conditions inside are just too dangerous for the team. So we typically use the OSHA 1910-120 standard as a best practice, and we also try to embed any local regulations that they have pertaining to hazmat and any types of control measures they have on the chemicals that they have going through their country. So the materials that we leave them with laminated field guides that are typically printed out in their native tongue. So Spanish, Russian, English, along with the course materials. We have translators on site just to ensure that the students all have access to the materials that we're presenting to them in their native tongue and the interpretation of our lectures when we're in country, given our lectures.
Can you wrap up, please, Brian? We're running out of time slightly, sorry.
Correct. So again, process of handling hazardous material sites. Where we can, we do live demonstrations, we do decon, we have them sample unknowns, and this is going to help them with the waste management as far as categorizing their waste, because some of our other presentations involving packing the waste, transporting it to an incinerator or for encapsulation, we're training them to identify acids, corrosives, the bases, solvents, flammables, and again, with this in mind that someone will be coming along and packing this waste for incineration or for encapsulation. Does anybody have any questions? I'm not sure if we have time. I can wait till later.
I think we can do one or two questions if there are, Brian. Are there any questions from the floor?
No, there are no questions. There's one question that came in here that says, any situation in training on hashish production cannabis indoor grow? I think there are no questions for the presenter at the moment. There is a hand raised from Karim Hakim. Perhaps we have time to just take that one comment from Karim Hakim, and then we go to the next presentation just in the service of time.
So I'll answer that real quickly. Yes, we do cover the extraction of cannabis. One of the drawbacks we have is a lot of the countries aren't prosecuting on that too. So since these guys are in there for evidence collection, and we usually find out from the source, the people, the boots on the ground people, that if they're prosecuting these cases, we do cover that, and we do demonstrations on that and how hashish or THC resin from the marijuana is produced.
So thank you, Brian. Brian, thank you very much for your presentation. I just missed you when you were in South Africa. I think you were here at the end of November. Some of my colleagues, they were fortunate to be part of your training, and the feedback I got from them is just full of praise. So thank you very much. Thank you very much for the presentation. Thank you for taking the time. I'm going to put over to Andrew just to introduce our last presentation. Thank you so much. Thanks, Brian.
Thanks, Henning. The last presentation of this session will be a recorded presentation that's delivered by a colleague of ours, Julian ter Huurne. He's an e-learning officer who's working at the European Agency for Law Enforcement Training. That's CEPOL. They're based in Budapest, there in Hungary. And Julian's presentation is all about the EU resources for training on synthetic drugs and lab dismantling. So I'm hoping the technology works and someone can queue up Julian's presentation, please.
Hello, my name is Julian ter Huurne and I am the portfolio holder for training in the area of drugs trafficking at CEPOL. I'm pleased to introduce you to the EU approach to training on dismantling synthetic drugs laboratories, and I will do so in 2 steps. The first one will be that of covering the framework of training illicit drug production in EU, and secondly I will give some examples with regards to training activities, the resources that we use for those, and the media that we use to cover those resources. First, something about the framework. We have, of course, a training needs assessment that we get input from COSI, as well as from the EU Serious and Organized Crime Threat Assessment. Then there is MPACT, and MPACT stands for the European Multidisciplinary Platform Against Criminal Threats. And in this, which is very operational, we have operational priorities of cocaine, cannabis and heroin on the one hand, and synthetic drugs and NPS on the other hand, which very concretely provide us with input for the training needs assessment. Furthermore, there's the European Commission who provides us with input, as well as Europol, EMCDDA or the EU Drugs Agency, and Eurojust who provides us with input for the training needs. Finally, I would have to mention also the member states of the EU who provide us with that input, and then together the training needs are translated into an implementation plan of actual training in the area of cocaine, cannabis and heroin on the one hand and synthetic drugs and NPS on the other hand. Yes, indeed, through MPACT. And through training actions, law enforcement and the judiciary is being professionalized within Europe. One action coming from the synthetic drugs and NPS priority is that of the participation in this global coalition. That's action number 8.3. Now, with regards to training and professionalization, I'd like to show you something about the 2024 training courses that we will organize. And the first course that I'd like to mention is that of the illicit drug laboratory dismantling course, and that's an advanced course. You see some footage over here as was shot of the event that was held in 2023, so this year. And this course is for practitioners who are already working in the area of drug production and tackling drug production crime. A second course would be the follow-up to that course, and that is for those people who 2 years ago took the advanced course. So in 2024, it is for the people who took the 2022 advanced course. Next, there is the course Combating Drug Production Crimes through VR. VR in this case is used to safely learn how to enter a drug or suspected drug production site, as well as how drug production sites can be recognized. Dismantling of cannabis production and trafficking is a fourth course. The fifth one is drug crime and markets, strategic analysis, as well as drug trafficking methods, mail and postal parcels. But for the sake of this presentation, the first 3 courses are most relevant. We do have one restriction though, and that is the limited reach of 35 officers that can be trained per course per year. We tackle this by introducing learning resources. These learning resources are in the shape of e-lessons. We call them e-lessons, and 10 titles are available in the series on illicit drug laboratories. Each of them are 60 minutes long in terms of study time. They can be used individually, also known as self-paced learning resources, or they can be used to be embedded in formal training courses by trainers or course managers. Each of these e-lessons are introduced with a so-called explainer video, and in this case you see an example of how that is explained about amphetamine production. These are 1.5 minute long videos. Furthermore, these videos and the e-lessons themselves are embedded into our learning management system. all in one category of illicit drug production, as you can find over here. And I will go into the one on MDMA, that's ecstasy. You find it over here. The introduction video is where we start, and then there's a virtual tour. Now the virtual tour can be seen full screen, and you can browse around the virtual tour through 360 degrees photos. And on these photos you find so-called hotspots. In this case you find the general description of MDMA. It can also be listened to, this description. We always focus also on safety measures, so that is one of the hotspots that you find on the first page of each of these series. And when you enter into the lab itself, you will find and you can explore through the hotspots in a meaningful manner, in a context-rich manner, the content, the learning content with regards to illicit drug production. And for those who have completed the quiz for the e-lesson successfully, we issue certificates and badges. The advantages of these e-lessons is that we have a high reach of the target audience. So far in this year we have 1,575 users over the 10 e-lessons that we have alive at the moment. The content of the e-lessons is very meaningful and context rich. That means that all of the content is placed in an authentic learning environment. And the levels achieved in terms of critical thinking is remembering, understanding, applying of the knowledge, as well as analyze knowledge, even as far as to evaluate the knowledge. And we have a very high satisfaction rate of the users, which currently stands on 97.8% of the people who are happy, are pleased, or satisfied with the e-lessons as a whole. And it is supported by multiple media. The e-lessons can be viewed on a desktop or a laptop, even on mobile devices and virtual reality goggles. Let me demonstrate you how this VR works. You need goggles for this and you need your mobile phone. So if you open the virtual tour on your mobile phone, you see it as such. You can then also select the icon of the VR goggles at the top right corner, and the mobile phone needs to be turned over 90 degrees. Then you see the hotspots and the content of the hotspots as such, and you have to listen to the audio instead of reading. You can navigate through the different rooms of each of the illicit labs and browse through the hotspots of the content of the equipment, of the material that you find in the room. These are the goggles that we use. These are foldable cardboard goggles that if you prepare the mobile phone, set up the virtual tour and place that inside the goggles, you will be able to view the virtual tour through the goggles. This is rather immersive, and you will get a lot more impact of the learning. The effect of learning is much higher instead of using it by desktop or laptop alone. The titles that we have available in the series of illicit drug laboratories are amphetamine production, cannabis plantation, cocaine extraction and processing. We have drug waste dump sites, MDMA, small-scale or kitchen-style methamphetamine production, or large-scale methamphetamine production that's based on BMK and pressure reaction, new psychoactive substances, precursors, and tableting sites, and they are available free of charge for all EU law enforcement and judiciary officers through CEPOL's learning management system. Through testimonials, we learned what users think about these e-lessons. I'd like to share some of them with you. I was surprised to see that the e-lesson itself wasn't a simple boring course and was more like a real-time investigation, which means that we actually managed to achieve the context richness and authenticity of the drug laboratories. This is basic knowledge for a public prosecutor, but unfortunately it's not taught anywhere else, which means that we actually managed to reach and trigger a training need of a target audience that has not been triggered before. This Latvian colleague states that MPS are a real danger in my country, and this course will definitely help me in everyday duties in forensic analysis and helping law enforcement officers. In other words, this colleague mentioned that the knowledge and skills covered in the e-lesson is applicable for him. The use of the interactive search scene was excellent. I will use this type of interactivity in courses in which I'm an instructor, so it's not only relevant for practitioners but also for teachers and trainers. And with this, I'd like to thank you for your attention. I would like to hand the floor back to you, Andrew. Thank you.